Life has a way of quietly wearing us down. Deadlines, responsibilities, unexpected twists, and they can leave us feeling off balance long before we notice. Now in England, 1 in 6 people experience symptoms of common mental health problems like anxiety or depression each week, and that's why it's so important to pause and check in with ourselves, what I like to call a bit of a mental health MOT. Think of it like a regular service for your car. A small check now can prevent bigger problems later. Early warning signs often appear subtly. Emotional exhaustion might feel like heaviness or lack of joy. Motivation fades, sleep becomes less restorative, and irritability can creep in. And these signals aren't weakness, they're just your mind's way of telling you that it needs attention. Catching them early can prevent burnout and protect your well-being, relationships, and give you clarity of thought. A simple self-check-in only takes a few minutes, so ask yourself, how are my energy levels? How balanced is my mood? Am I sleeping well? How motivated do I feel? And am I feeling calm or tense in my body? Now score each on a scale of 1 to 10. And a total consistently below 7 might indicate it's time to recharge. Writing your scores down can help reveal patterns over time and help you act before things get worse. Small changes can make a big difference. So start with boundaries. Say no to one non-essential request or define off-duty hours where work notifications are silenced. Digital habits also matter. So reducing evening screen time, charging your phone outside the bedroom, or using app timers can improve mood and sleep. Research does show that even modest reductions in screen use can have effects similar to therapy. Routine is another stabilizer, so regular sleep, consistent meals, brief walks, or short relaxation rituals can give your body and mind structure. Now combine these with meaningful social connections, a weekly coffee, a shared activity, an evening phone call, and you can strengthen your mental resilience. Movement matters too, so gentle activity, even just a 10-minute walk or a few stretches, can release tension and boost mood. And it doesn't have to be intense, consistency is what counts. Remember, self-care is vital, but professional support is sometimes necessary. So persistent low mood, anxiety or withdrawal are all signals for you to reach out to your GP. In England, we have NHS talking therapies and charities like Mind and Samaritans, which can provide evidence-based support and advice. A mental health MOT isn't actually indulgent, it is really preventative. One small check-in, one screen-free evening, one intentional boundary. These actions add up, and by listening to your mind and taking early steps, you can protect your clarity, your resilience, and overall well-being. So tune into yourself. Prevention beats cure every time.